All right. So welcome back. In this edition of our partnership and conversation with Dr. Nicole, we're going to be talking about functional oncology during active treatment. So whether that's chemotherapy, immunotherapy, surgery, kind of what those supports look like, what supplements, habits, and things that you could be doing on top of your conventional oncology plan. So for me, I went through chemotherapy last year. Unfortunately, I didn't know Dr. Nicole at the time. So I was just kind of navigating based on Google search knowledge and the knowledge that was provided to me from my conventional oncologist. So I was experiencing the fatigue. I had some of the nausea, the appetite loss or like food aversion. What else? I didn't have a ton of neuropathy. There was and is still quite a bit of brain fog. But I think the fatigue was probably my biggest thing. So Dr. Nicole, can you talk me through some of the things that I could have been taking or doing during chemotherapy to kind of help with those side effects?
Yeah, so just like in conventional oncology or conventional medicine, we look at different lab values that will help us figure out what is going on. So some of the things that we look at in conventional and functional medicine are the same. So like vitamin D, your hemoglobin, if your hemoglobin's low, your iron's low, that can cause you to be fatigued and tired all of the time. But there's a few different things that we look at in functional medicine that is a little bit above and beyond. So we look at more target nutrient depletion, how your body is handling those nutrients, mitochondrial stress that's causing you not to tolerate treatment as well and causing that fatigue. And then looking at like evidence-based supplements like magnesium, B complex vitamins, CoQ10, iron if your iron is low. And then in some cases, like any peptides to support tissue repair and immune resilience, if those are needed, but need to always be used like under provider supervision with the peptides.
For sure. Okay. So in my Google searching and TikTok searching, there's lots of different types of information out there, right?
Yes.
And there's some information out there that will say, you shouldn't take this, during chemo because it reduces efficacy. So can you talk through whether or not there are specific supplements or that should never be taken during chemo?
Yeah, I recommend talking to your oncology team about any type of supplement or herb or anything that you're putting in your body, just because it can really interfere with your chemo. It can make your chemo very toxic, or it can make your chemo not work. Both things that we don't want to do. Okay. So some supplements can definitely interfere more than others. Some things that I would recommend staying away from are large doses of vitamin C, vitamin E, or like herbal detox products that can really like mess with how your treatment is going to be tolerated. And just kind of a forewarning that no supplement on the market is really regulated in what's all going in there, how much is going in there, also where you get your supplements. It's a huge difference if you're buying your supplements from like a medical grade company versus like Amazon. Those products are definitely not regulated and not necessarily getting what you're think that you're going to be getting. So it's really important to be careful and talk to your oncology team.
Yeah, for sure. Thank you. Another kind of side effect is our immune system, right? So we are, kind of immunocompromised while we're going through chemotherapy. And I know I wore my mask religiously in my home with my children, especially. I always joked and said that I was more susceptible to getting sick by just being in my house than being out in a big crowd, honestly. So can you talk through how you kind of help patients support their immune system during treatment?
Yeah, during chemotherapy or when your immune system is down and really through any kind of cancer treatment, working on just like the basics. So like nutrition, gut health, stress regulation are all really important. Making sure that you're getting adequate protein, having key nutrients, and staying hydrated really helps the immune cells function properly. And so we can manage like our blood sugars, inflammation, and that puts like extra strain on the body. And then we just want really to focus on like gentle movement and nervous system support, because that chronic distress suppresses the immune function. And so we really want to keep the immune function as resilient as possible through treatments.
Yeah. Yeah, that was me. Like, I think we were talking about this earlier, but trying to think through, what types of movement would be beneficial for me. In my mind, I had my idea of like how I wanted my workouts to go, but I didn't necessarily have the energy to do those things, or my body just couldn't physically do some of those things after surgery. So trying to like reframe and think through what's my goal right now, what's the focus right now, which would be healing, recovery, and rest. So what movements, maybe yoga and stretching, that might be better for me to do right now in this season. But you mentioned gut health. Can you talk more about the role that gut health plays during chemotherapy and immunotherapy?
Yeah, gut health is so important for your immune system. Actually, most of your immune system lives in your gut. And so when you're going through cancer treatment, whether it's chemotherapy, hormone therapy, surgery, it really can disrupt the microbiome in your gut and the gut lining. And that can make side effects like nausea, diarrhea, constipation worse, and even cause your immune system to be lower than what it needs to be. So like in functional oncology, we help to support the gut, and we actually do gut testing often, that we can look at like inflammation, the microbiome, what is going on, and treat that root cause to help treatment tolerance, and just how you're feeling overall.
Yeah. And similarly, after surgery, I went through, I think, like 2 weeks of where my stomach was just not, it was just not happy. Every time I would eat, I would get an upset stomach. So can you talk through how functional oncology supports you after surgery, after we've had all those antibiotics and the anesthesia and all of that? How do you support us kind of recovering from that as well?
Yeah, good question. Really optimizing nutrition, reducing inflammation, and promoting just healing overall. You hit it head on when you're saying about the anesthesia. People can have lingering effects for days to even weeks just because of the anesthesia. But now throw the antibiotics on top of that, the pain meds after surgery. There's so many different things that can mess with the body. So really focusing on like adequate protein, making sure you're getting like good complete protein, key nutrients that are needed to help repair the tissue, help repair the cells, and then support lymphatic drainage, sleep, stress reduction, really kind of all go into healing from surgery as well.
Yeah. Thank you. That's so good. I know for me, like the protein thing, in the workout world, and it's protein is all the rage right now. But going through this process is when I really learned the importance of it on a cellular level and on a just health level versus, oh, I need protein to bulk up or to feel more full. But we actually need the nutrients in the protein for our body as well. So that was something that was kind of eye-opening to me through this process.
Yeah, it's amazing. Definitely helps the body heal faster, and
Yeah.
even just like your GI system too. Like one thing that I always like to tell people is, we always get up in the morning and we drink our cup of coffee like first thing, but
Mhm.
actually having a little bit of protein in your body, in your gut before you drink your coffee is actually going to help you feel better, help your digestion, help your energy throughout the day as well.
Wow, that is a nugget that most people definitely don't know. So thank you for
Yes.
sharing that.
Yeah.
Yeah, this has been a great conversation. We hope y'all enjoyed learning more about how functional oncology can support you during active chemo treatment.